Hey everyone, let's dive into the intricate world of cranial nerves. Today, I'm breaking down everything you need to know about their functions, pathways, and what happens when they get damaged. First off, cranial nerves are essential for many body functions and originate from nuclei in the brainstem and forebrain. There are 12 pairs, each with unique roles. Let's start with the olfactory nerve. This is cranial nerve I, responsible for the sense of smell. It originates in the olfactory bulb and travels through the olfactory tract to the brain. Damage can lead to anosmia, or loss of smell. Next, the optic nerve, or cranial nerve 2. It carries visual information from the retina to the brain. Originating from the retina, it passes through the optic canal and converges at the optic chiasm before reaching the occipital lobe. Damage here can cause visual field defects or blindness. Cranial nerve 3 is the oculomotor nerve. It controls most of the eye's movements, the constriction of the pupil, and maintains an open eyelid. Originating from the midbrain, it travels through the cavernous sinus to the eye. Damage can result in double vision, ptosis, and pupil dilation. The trochlear nerve, cranial nerve IV, is the smallest and controls the superior oblique muscle of the eye. It also originates from the midbrain and moves through the superior orbital fissure. Damage here can cause difficulty looking down and in. Let's move on to the trigeminal nerve, cranial nerve V. It's the largest and has 3 branches: ophthalmic, maxillary, and mandibular. It handles facial sensations and motor functions like chewing. Originating from the pons, damage can result in loss of sensation or severe pain, as seen in trigeminal neuralgia. Cranial nerve 6 is the abducens nerve. It controls the lateral rectus muscle, which abducts the eye. Originating from the pons, it travels through the superior orbital fissure. Damage can cause inward turning of the eye, known as esotropia. The facial nerve, cranial nerve 7, controls facial expressions, taste sensations from the anterior 2/3 of the tongue, and some gland functions. Originating from the pons, it passes through the internal acoustic meatus and stylomastoid foramen. Damage leads to Bell's palsy, causing facial weakness. Cranial nerve 8, the vestibulocochlear nerve, is crucial for hearing and balance. It originates from the inner ear and travels to the brainstem through the internal acoustic meatus. Damage can result in hearing loss, vertigo, or balance issues. The glossopharyngeal nerve, cranial nerve 9, deals with taste from the posterior third of the tongue and some muscle functions in the throat. It originates from the medulla and exits via the jugular foramen. Damage can affect swallowing and taste. Cranial nerve X, the vagus nerve, is vital for parasympathetic control of the heart, lungs, and digestive tract. Originating from the medulla, it travels through the jugular foramen. Damage can lead to voice changes, trouble swallowing, and autonomic dysfunction. The accessory nerve, cranial nerve 11, controls the sternocleidomastoid and trapezius muscles. Originating from the spinal cord and medulla, it exits through the jugular foramen. Damage can cause shoulder droop and difficulty turning the head. Finally, the hypoglossal nerve, cranial nerve 12, controls tongue movements. It originates from the medulla and exits via the hypoglossal canal. Damage can cause tongue weakness and atrophy. Cranial nerves are fascinating and complex. Understanding their pathways and functions can help you diagnose related nerve damage effectively. Keep studying, and you'll master them in no time. Thanks for tuning in.